Hello and welcome. Today we are tackling a subject that I know can be a little intimidating for a lot of people, nursing dosage calculations. But my goal here is to help you swap that anxiety for confidence, because knowing you're getting this right is one of the most critical skills you can have. And when it comes to keeping our patients safe, there is just zero room for error.
So here's our game plan. We're going to start with the why. Why this is so important in the first place. Then we'll get into a fantastic universal formula that's going to be your new best friend. We'll use it for tablets and liquids, then we'll level up to IV drip rates, and finally tackle the really high-stakes world of pediatric doses. You'll see, it all builds on itself.
Before we even touch a calculator, I want you to just let this question sink in. It really frames the immense responsibility we have, doesn't it? That gap between a doctor's order on a chart and a patient's life, well, that's where you come in. That's where your skill and your math matter more than anything. Okay, let's dive right into our first section, why nursing math matters. And I'll give you a hint. This isn't about passing an exam. It's about being that critical link that ensures your patient's safety. Wow, this slide really says it all, doesn't it? One little slip of a decimal point can literally turn a life-saving medication into a poison. This is why, in the real world, accuracy isn't just a goal we're trying to reach, it is the standard. It's the only way. So how do we make sure we hit that standard every single time? Well, that brings us to section 2. Let's talk about a tool that is going to be your absolute foundation for confidence.
And here it is. People often call it the desired over have formula. And honestly, it's the key that unlocks so many of these problems. Let's just break it down real quick. You take what the doctor ordered, that's your desired dose, and you divide it by what you actually have in your hand from the pharmacy, your dose on hand. Then you just multiply by the quantity. It's so simple and it's so powerful.
All right, enough theory. Let's see this thing in action. Section 3 is all about putting this formula to work in one of the most common situations you'll face, figuring out doses for tablets and liquids. Here is a classic everyday scenario. The doctor orders 500 milligrams of something. You go to the med cart, you pull out the bottle, and inside are 250 milligram tablets. So the question is simple. How many do you give? Let's just plug it into our formula. Step 1, what do we desire? 500 milligrams. Step 2, what do we have on hand? 250 milligrams. Step 3, we pop those numbers into our formula. We've got 500 divided by 250, and we'll multiply that by our quantity, which is 1 tablet.
And there you have it. The answer is 2. You're going to give exactly 2 tablets to deliver that 500 milligram dose. See? It's simple, it's clear, and most importantly, it's accurate. The formula just works.
Okay, so we've got the basics down. Feeling good? Let's level up and build on that foundation. We're moving on to section 4, mastering IV drip rates. Now this can seem a bit trickier, but it's really just about using the right formula for the job.
So here's our next puzzle. The order is to infuse a whole liter of saline, that's 1,000 milliliters, over an 8-hour shift. Now besides the volume and time, the other key piece of information here is the drop factor of the tubing itself. In this case, it's 15 drops per milliliter, or GTT/ml. Our job is to figure out just how fast that IV needs to be dripping. First off, let's make sure we're on the same page. What even is an IV drip rate? Well, it's exactly what it sounds like. It's the number of drops, or GTT, that need to fall every single minute to get the right amount of fluid in over the time the doctor prescribed. And here is the formula that's going to get us there. You take the total volume, multiply it by the drop factor, and then divide all of that by the time. But listen up, here's the crucial part. The time has to be in minutes, so you absolutely have to convert those 8 hours into 480 minutes first. Once you do that, you just plug in the numbers, 1,000 times 15, and divide the whole thing by 480.
And that gives us 31.25. Now, since we can't exactly count a quarter of a drop, we round to the nearest whole number. So the correct IV drip rate is 31 drops per minute. That is the kind of precision that ensures the patient gets exactly what they need when they need it.
All right, deep breath. We're heading into our final section, and this is where the need for precision is at its absolute highest. We're talking about weight-based and pediatric doses.
For adults, a lot of doses are pretty standard, right? It's kind of a one-size-fits-most deal. But with kids, no way. One size absolutely does not fit all. Their doses are almost always tailored to their exact weight because their smaller, developing bodies handle medication so differently. And just look at this table to see how much of a difference it makes. With a sample order of 10 milligrams per kilogram, the actual dose changes dramatically. A tiny 5-kilo infant gets 50 milligrams, but a 30-kilo child needs 300 milligrams. You can see how getting that weight even a little bit wrong could lead to a massive dosing error.
So here's the deal. It's really a two-step process. First, you have to figure out the total dose your patient needs. You do that by multiplying their weight in kilograms by the dose the doctor ordered. Then, you take that number and it becomes your new desired dose in that same universal formula we started with. And step 3? It's not really a math step, but it is the most important rule of all. Double-check everything. The math, the units, everything.
Okay, we've covered a lot of ground today. So what are the big takeaways? Number 1, accuracy is everything when it comes to patient safety. Number 2, that desired over have formula is your best friend. It's your foundation. For the trickier stuff, like IVs and PEDS, you're really just adding a few extra steps onto that foundation. And finally, real confidence doesn't come from just memorizing formulas. It comes from really understanding the process behind them.
So I'll leave you with one final question to think about. The math is a tool, a really, really important one, but it's not the whole job. After the calculator's put away and you have your answer, what is the single most important human check you're going to make before you give that medication? Something to carry with you.